welcome back to another interesting episode of Manju's Testimony. If you are new over here, I'm Manjusha. I'm doing Oet related content videos. Today in this video, I'm going to solve Oet reading part B. I will be solving 6 questions which will be worth watching. I'm pretty sure that you people will definitely get benefit from this video, so kindly watch this video till the end without skipping any of the segment. I will be telling all the rationales behind both the right and wrong answers, so guys, trust me, it is worth watching. Okay, so without any lag, let's go to the video. And I'm so grateful that you people are really watching my videos. I could understand it from my watch-outs that you people are really watching, but I feel that you people are a bit reluctant to do like, share, subscribe and comment. Please, if you feel that my videos are useful, kindly subscribe, like, share and comment, and I will be happy to answer any of your concerns, doubts or feedback. Okay, so let's go to the video. Thank you so much. So guys, let's start with the question number 2, because I feel that the question number 1 is a bit easy one, so that's why I just start from question number 2. So let's read the question. What does staff need to be conscious of when working in Anterooms? So we have to read the option first. I hope you remember before in my previous videos I told you already, for reading part B it's better to read the question first, then read the options and go to the text to find out the answers, because this is by reading options first you can sometimes find out some keywords for which that you can look in the text to find out answers. So in this case you don't have to spend a lot of time to find out the right answers. You can simply find out the answers with keywords and easily move on to the next question. So here we can save the time, but it is not in all the cases. There are so many questions which ask for the complete objectives of the text, so in this case you have to read it completely. So by understanding the question you can decide whether you have to read the text completely or just to search for some keywords and find out the answer from the keywords. So that's why here I read the options first. So now we're gonna move on to the text. Okay, Anterooms. Anterooms allow staff and visitors to change into and dispose of personal protective equipment used on entering and leaving rooms when caring for infectious patients. Clean and dirty workflows within the space should be considered so that separation is possible. Anteroom increase the effectiveness of isolation rooms by minimizing the potential escape of airborne nuclei into a corridor area when the door is opened. For class and isolation rooms, the pressure in the anteroom is lower than the adjacent ambient corridor pressure. The positive with and it is positive with respect to the isolation room. The pressure difference between rooms should be not less than 15 Pascal. Anterooms are provided for class and isolation rooms in intensive care units, emergency departments, birthing units, infectious disease units, and for an agreed number of patients' bedrooms within inpatient units accommodating patients with respiratory conditions. So I took literally time to read all the questions just for you to understand. But you have to be keen on your time when you do your practice or in the real exam. Okay, you should not be like this. You have to read it carefully and very fast. Okay, and in some cases just search the keyword and find out the keyword from the text and easily find out the answer. Okay, so here your understanding I will explain everything. So now let's move on to the text to find out the answer. So the first option is keeping used and unused medical clothing apart. I have to say one thing. We already read the questions, read the options, read the text, and now we are searching for the answer from the text. Okay, but while we read the text to find out the answers, we may have a tendency to forget the answer options and the question. We may deviate from the question and options. We just concentrate only on the text. So it will happen most of the time. So be keen on your question and answers. So for that, you have to come in between the text reading to the options and questions and remind yourself that this is the question and this is the options. What all things we have to search in the text for, not just read the text carefully and concentrate. Okay, read the text to find out the answer for the question, not just thoroughly read the text. So it happened to me sometimes, because when I read carefully the text, sometimes in between I forget the question. Literally, I forgot for what I am reading the text for, and the options also I forget. So in that case, what I did was, I go in between the text reading to the options and the question and remind myself that okay, this is what I'm searching for. Okay, so likewise, I will show you how it will come in between. Maybe you are also facing the same problem. So this is quite normal, because we have to concentrate more in part B and part C, unlike part A. So it can happen, we may forget while reading text carefully. So let's start reading for the options. First option we already read, keeping used and unused medical clothing apart. So let's read again. Anterooms allow staff and visitors to change into and dispose of personal protective equipment used on entering and living room when caring for infectious patients. You know what is actually anteroom? Anterooms, just for your understanding, let me explain in a brief about anterooms. Anterooms are in our ICU, there is a room in between the ICU and corridor. Maybe you have seen somewhere. It's most commonly seen with airborne infection ICU. I mean isolated rooms, airborne infected patients room, inpatient rooms where airborne infected patients are being kept. So this room specifically designed to prevent the escape of air from the isolated room to the outside corridor. So that means this room is situated in between the outside corridor and the ICU. So where we usually keep the chappals, then the PP. So the people from the corridor, I mean from the outside, the bystanders comes into the anteroom first. They change, or they change their chappals, and they put the new chappals there, wear all the PP and get into the ICU. Likewise, when they return from the ICU, they remove all the PP there in the anterooms. There is a waste basket. They put the linen there, and there is already clean linen and dirty linen. So they removed the dirty linen and they went outside, right? So this is the anteroom, and the purpose of anteroom is to prevent the air escape from ICU to the outside corridor. So this is what they are really explaining here. Anterooms allow staff and visitors to change into and dispose of personal protective equipment used on entering and leaving room when caring for infectious patients. So I already explained. So they remove the clothing. I'm not repeating anyway, you understand, right? So clean and dirty workflows within this space should be considered so that separation is possible. This is the most important sentence that we need to stick on. Okay, clean and dirty workflow. So I already told you, there is the patient, the bystanders are coming and changing, and they enter, and then when they go back, they remove the dirty linen. So there is a clean and dirty workflow take place. What is meant by clean and dirty workflow here? The bystanders, or the people who enter into the anteroom, wear the clean linen, I mean clean PPE, clean mask, and they enter into the ICU, right? When they come back, the linen and the mask and whatever PPE they have used already become unsterile or dirty, and they remove in the dustbin there, in the waste bin there, right? So these all things happen inside the same anteroom. So that means there is a clean and dirty workflows happening in the room. This is the area where both clean and dirty workflow happens, right? So they are saying that clean and dirty workflow within this space should be considered so that separation is possible. So the people who are handling or who are managing this anteroom should consider the clean and workflow in the anteroom, and they have to maintain like that. So that means they have to keep the clean items in one area, and the dirty items in other area, in opposite areas of the same anteroom. So here our first option is keeping used and unused medical clothing apart. What is that? So let's read the question. What does staff need to be conscious of when working? Okay. The staff need to be, what about the staff need to be conscious about when they're working in the anteroom? So that means the people who are handling or managing the anteroom should consider the dirty and clean workflow within the anteroom while managing it. Okay. So the first option, keeping used and unused medical clothing apart. The same meaning is rephrased here in the sentence. Clean and dirty workflows within this space should be considered so that separation is possible. That means they should keep the clean and dirty items apart. So this is what exactly keeping used and unusual medical clothing apart, but don't expect the text will repeat the same sentences in the option. So it is always seen as rephrased. Okay, we have to understand the meaning of the rephrased sentences in the text to understand that this is the same thing what they are mentioning in the option. So this is the task in option B. They won't give you exactly the same sentence as it is in the text. Okay, but we cannot confirm the answer right now. We just keep it standby and we have to eliminate the other two options as well. Then only we can confirm that option A is the right answer for this question. So let's read the question B. Ensure the ambient pressure in the room is minimum 15 Pascal. So here comes the importance of keyword. As I told you before, you can find out some keywords in the options to find out the text so that you can find out easily the answers without spending too much time on it. So here we have seen 15 Pascal in the option, right? When I was reading the test, I have also noticed a 15 Pascal somewhere in the text. Okay, just scan the text for that. Yeah, it is in the second paragraph. It is mentioned the last word as 15 Pascal, right? So let's read it. We don't have to read anything in the first paragraph for 15 Pascal. Just read the second paragraph. For class and isolation rooms, the pressure in the anterooms is lower than the adjacent ambient corridor pressure and positive with respect to the isolation room. The pressure differential between rooms should not be less than 15 Pascal. I have to explain something about the pressure in the anteroom. Then only you can understand clearly what it is. Okay. I know that the sentence is very clear that the pressure difference between rooms should not be less than 15 Pascal. So that what does it mean? That means there is a pressure differences in the rooms. I mean the anterooms, in the isolation room and the outside corridor. But the difference between these pressures in the rooms should not be less than 15 Pascal. So here in the option B, it mentioning that ensure the ambient pressure in the room is a minimum of 15 Pascal. So what they have said is, and the people who manage the anteroom should ensure that the ambient pressure in the room, in the room means specifically inside the anteroom, is a minimum of 15 Pascal. So it should be maintained a minimum of 15 Pascal. But in the text, it says that the pressure differential between the rooms should not be less than. That means the difference in the pressure between the rooms should not be less than 15 Pascal. Not exactly in the anteroom, only the differences. So in that, for more understanding, I just would like to explain more details about the pressure. Then only you can completely understand the meaning. You know, when you deal the questions in part B and part C, you have to go in depth detail to the sentences and the scenario for the questions. Okay, because OET sometimes repeat the same, not exactly the same question. Sometimes they repeat the same theme, the same idea in different questions. I have seen a lot of questions. I have done a lot of reading questions. So I came to a conclusion that the OET is repeating the same theme in different questions. So that's why I'm telling you, you have to be in depth while analyzing question B and question C. That's why I'm gonna tell you a little more explanation about pressure differences, what is anteroom pressure, why there is a pressure difference between. So I'm sure that it will definitely help you to answer some future questions in another question papers. I know that you people may know about these pressure differences in the isolation rooms and anterooms, but the people who are not working in the ICU may not know about it, right? So anteroom means, I already explained about anterooms. What is the pressure? Why there is a significance in pressure, in keeping pressure in these rooms, and why they are saying that there should be differences between the pressure in between the rooms. Anterooms means it is always associated with the airborne isolation rooms. What is airborne isolation rooms? This is a specialized isolation room specifically designed to keep airborne infected patients, because airborne infected patients are highly contagious and the infection can be spread to others very easily. So that's why these isolation rooms should be kept under negative pressure. That's what they mention for class and isolation rooms here in the second paragraph starting. Class and isolation room means negative pressure isolation. N means a negative pressure isolation rooms. So airborne in isolation rooms are always under negative pressure. Why it is keeping a negative pressure inside the room? Air particle always travel from positive air area to a negative pressure area, right? So the particle can travel only from positive area to negative area. So if the anterooms kept under negative pressure, so the pressure from outside can be transferred to isolation room. That's fine, it's okay, because isolation room is already infected, and if the air passes from outside to inside the anteroom, that's fine. But our aim is to, or the isolation room's aim is to prevent the escape of air from the isolation room to outside corridor, because the air inside the isolation room is infected, and if it's escape or go outside, it will infect all other people who are there in the outside corridor. Okay, that's why we keep the place in the negative pressure. So what about the pressure in the anterooms? We are talking about anterooms here, right? So what about the pressure to be kept in the anterooms? So here they tell us that anterooms, the pressure in the anteroom is lower than the adjacent ambient corridor pressure and positive with the respective isolation room. Why it is like that? When compared to outside corridor, the anteroom pressure should be lower. That means the outside pressure is positive and the anteroom pressure should be negative. So the air particle from anteroom should not travel from anterooms to outside, because we already told in the first paragraph that the anterooms is a place where clean and dirty workflow takes place, right? So it is already infected, not exactly like isolation room. Anyway, it is infected because there is clean and dirty workflows take place. So the air inside the anteroom is already infected, and it should not also be left into the outside corridor. That's why the pressure inside the anteroom should be in negative compared to the outside corridor, so that the particle from negative pressure area will not travel to outside corridor. But when compared with isolation room, the pressure inside the anteroom should be positive as well. So why it is like that? As I told you before, inside the isolation room it should be negative in order to prevent the escape of air particle from the isolation room to the anteroom. So anteroom's air should be positive when compared to the isolation room, so that the particle from the isolation room will not be traveled to the anterooms. If it's traveled to the anteroom, there will be more infection. The anteroom is more infected, exactly like the isolation room, and there will be chance for getting the infection to the outside corridor people. Okay, so when keeping the pressure inside the anteroom, it is in negative pressure compared to the outside corridor and positive compared to the inside isolation room. And in the second sentence, what they have mentioned, the pressure differences between these three areas, these rooms. So we explained about the outside corridor pressure, in anteroom pressure, and isolation pressures, right? So the pressure differences should not be less than 15 Pascal, not exactly the pressure inside the anteroom. But in the option, what it says that the pressure in the room should be kept under 15 Pascal. So that is completely wrong, and now we can eliminate option B. Okay, so now we're gonna move on to option B, keeping the door closed at all time. Okay, let's read the option text for doors. keeping doors all the time. So we did not read the third paragraph yet. So anterooms are provided for class and isolation rooms in intensive care unit. So this is all about, we already read before. This is all about where the anterooms are provided. It is in class and isolation room, then emergency department, birthing unit, infectious unit, agreed number of patients, bedroom, inpatient, accommodating patient with respiratory. So this is all about where should the anteroom kept. We don't have anything about the doors here. Here the option B is talking about keeping the door closed at all time. But we missed a sentence while we dealt the first paragraph. So let's read the missing segment in the first paragraph. We just read up to clean and dirty workflows within the space should be considered so that the separation is possible. And rooms increases the effectiveness of isolation rooms by minimizing the potential escape of airborne nuclei into a corridor area when the door is opened. So here we have seen the word door. Okay, so let's read that sentence again for clear understanding. Anterooms increases the effectiveness of isolation room by minimizing the potential escape of airborne nuclei into a corridor area when the door is open. So I think I don't have to explain the meaning again because I already explained a lot about why anteroom is there, what the function of anteroom. So the just I superficially explain the meaning here. Anterooms increases the effectiveness also. Anteroom already increases the effectiveness of isolation room by minimizing the potential escape to prevent the escape of airborne nuclei from the nuclei into a corridor area, into the outside corridor area when the door is opened. Only when the door is open. We all are healthcare professionals and we know that anteroom's doors is already closed, but it sometimes open and close when the patient or when the bystanders enter and go outside the rooms, but it is always closed, right? And it is an automatically closing door as well. So here keeping the option B C is saying that keeping the door closed at all time. We know that the anteroom's door should be closed at all time, but it is not mentioned in the text, right? It is not anywhere in the text that the door should be closed at all time. We know already, but we don't have to use we don't have any right to use our medical knowledge here. We have to extract the meaning from the text what only the text is mentioned about. Okay, we cannot use our medical knowledge because this is a reading test and our reading ability or our comprehension ability is being tested, not our medical knowledge. So you don't have any right to assume the answer of any of the questions. You just have to extract the meaning from the sentence what they have given in the text. Okay, so keeping the door closed at all time is not given in the text. It is mentioning that when the corridor area when the door is opened. Okay, whenever the door is opened, this anteroom will prevent the escape of airborne nuclei from the isolation room to the outside corridor. So option C is also be eliminated. So we now can fix option A as the right answer. Keeping used and unused medical clothing apart is the right answer for this question. Okay, so let's move on to the next question. What is the basic principle of flexible design? Creating system which match current policy and can adjust to other possible guidelines. Option B, designing healthcare facilities which strictly adhere to current policy. Option C, changing healthcare policies regularly to match changes in the marketplace. So let's read the text now. Flexible design. In healthcare, operational policies change frequently. The average cycle may be as little as 5 years. This may be the result of management change, government policy, the turnover of key staff, or change in the marketplace. By contrast, the major healthcare facilities are typically designed for 30 years but may remain in use for more than 50 years. If a major hospital is designed very tightly around the operational policies of the day or the opinion of a few individuals who may leave at any time, then the significant investment may be at risk of early obsolescence. Flexible design refers to planning models that can not only adequately respond to contemporary operational policies but also have the inherent flexibility to adapt to a range of alternative, proven, and forward looking policies. So we already completed the text. Now read the text to find out the answer. So let's find out the text about the option A. Creating system which match current policy and can adjust to other possible guidelines. So let's remind the question once more. What is the basic principle of flexible design? Okay, we are going to find out what is the basic principle of flexible design. Okay, so from this question itself, when we read the question itself, we could understand that this is not something has to be get from the keywords. So here this is the topic is literally different from our normal nursing topic. This is something different. It is related to something administrative level of hospital. So we don't have that much idea about the content, so we have to read the entire text to find out the right answer. Okay, so from the question itself, you have to design in your mind how you gonna find out the answer. It's by searching the keywords or by to read the entire text. So here we have to read the entire text to find out the right answer. So let's read for the first option again. Creating system which match current policy and can adjust to other possible guidelines. Creating system which match current policy. So they are saying that a system should come from a system should be there which match the current policy and can adjust to other possible guidelines. Let's read the text again. I couldn't find out anything from the keywords, possible guidelines, current policy. This is something really blank. So we have to read the text carefully again. In healthcare, operational policies change frequently. So what does it mean? Healthcare settings, example for hospitals, we have policies there in the hospital, right? So the operational policies change frequently. The policies should are changing frequently, or it should be frequently. This is because the average cycle may be as little as 5 years. So most of the hospital, in most of the cases, the average policy life is maximum 5 years only. Okay, this is because the result of management changes. So sometimes the management may change, the complete management panel of the hospital may change. The government policy can be changed. The turnover of key staff or change in the marketplace. Okay, the turnover of sometimes the main key staff, I mean the directors or the administrative level, the HR manager or the something important person can be changed. They may have resigned or terminated, or somebody else comes and replace the place. So in all these cases, the policy can be changed as frequently, a minimum of 5 years in most of the cases, or a change in the marketplace. So changes in marketplace also affect the healthcare policy changing. This is because hospital and hospital care is a market. That's why many of the private hospitals are emerging now, right? So the changes in the marketplace also affect policy changing, because marketplace changes will definitely affect the business, and if they keep on moving with the same policies, it will definitely affect their productivity and the business will be down. So they tend to change their policy as the changes as per the changes in the marketplace. So that what does it mean? By contrast, major healthcare facilities are typically designed for 30 years. So having said that, some hospitals are most of the hospitals change their policy within a minimum of 5 years. Some hospital, for example, the major hospitals are designed to keep a policy for 30 years. Sometimes it will be up to 50 years, okay, but may remain in use for more than. So even if they design the policy for 30 years, sometimes it may keep for more than 50 years. Okay, if a major hospital is designed very tightly around the operational policies of the day, of the opinion of a few individuals who may leave at any time, then the significant investment may be at risk of early obsolescence. Obsolescence means not robust. Okay, it's for just short term. It is not future proof. That what does obsolescence? In simply, I can say obsolescence means it is not durable. It is not long lasting. Okay, so if a major hospital is designed very tightly, so the sentence meaning is that if suppose a major hospital is designed designed very tightly around the operational policies of the day. Of the day means the policy has been formulated in a particular time, in a particular period, by some of the people who were working on that specific time. Based on their opinion, their judgment, they formulated some policies. But sometimes these individuals, few of the individuals who may leave at any time, as I told you before, these individuals, I mean the HR manager or the managing director or the administrative panel, can be changed, right? So they may resign, they may leave the hospital at any time, but the policy they have formulated already is there in the hospital, there in the system, and it's been following for years, up to 50 years. So if such thing happen, the significant investment, that means the investment in formulating these policies is at risk of early obsolescence. So the what all investment, what all effort we put to make these policies at a time for the hospital to keep it for 30 years minimum is at risk for early cancellation or early it is not durable, it is not long lasting, because the policy formulated by certain people and they left the department. So there is no amendment, there is no changes happening in the policy, and it keep for a long time. So it is not something which is ideal, and it is very outdated, and it will become outdated. Okay, so that is what means obsolescence. It become outdated. So flexible design refers to planning model that can not only adequately respond to contemporary operational policies but also have the inherent flexibility to adapt to a range of alternatives, proven and forward-looking policies. So they are saying that a flexible design, what we are talking about is flexible design. Flexible means a changing, can have the flexibility, right? So flexible design refers to planning model that can not only adequately respond to the contemporary operational policies. So contemporary means the policies happening at the current situation. Okay, so a flexible design should match with the contemporary policies, the current policies or the guidelines, but also have the inherent flexibility to adapt to a range of alternatives. Design should not only adequately match with the or go with the current policies, but also should have the inherent flexibility. Inherent flexibility means inclined, it should be originated, it should be from the origin itself, it should be flexible enough to adapt to a range of alternatives, proven and follow forward looking policies. What does meant by range of alternatives and proven and forward looking policies? Sometimes suppose we create a policy, but we feel that this is a good and something which has effect, which will have effect on the system, but suppose there is an alternative also. So there is an alternative can be considered at the same time of the created policy. So if the policy what we created is flexible enough to adapt to a range of alternatives, proven and forward looking policies. So the alternatives is very might be proven and forward looking policies. Proven means it's already proved that this policy would work, it is okay to implement. Okay, forward looking policies means more progressive, advanced, and has keen observation towards the future. Okay, so the policy what we created should have inherent adaptability, inherent flexibility to adapt to a range of alternatives, proven and forward looking policies. So creating system which match current policy and can adjust to other possible guidelines might be considered as the right answer, but which match current policy and can adjust to other possible guidelines. We have seen here, just now we told the policy must be matching with the contemporary operational policies, but also have the inherent flexibility to adapt. Okay, but here in the option it says current policy, up to that it is okay. Creating system which match the current policy, that is absolutely fine. But what about the next part of that sentence? And can adjust to other possible guidelines. Did we see anywhere about the guidelines and other possible guideline? No. What it says that it should match with the contemporary policy, at the same time have inherent flexibility to adapt to range of alternatives, proven and forward looking policies, not about the guidelines, right? The text did not say anything about adjust to other possible guidelines. No, there is nothing say about nothing say there is nothing about guidelines. So now we just can keep it standby. We cannot say that this is the right answer, just keep it there. We have to look for the other two options as well, then we can maybe choose it as the right answer if we don't get any other matching answers. Okay, so let's read the option B, designing healthcare facilities which is strictly other to current policy. This sentence is straight opposite to what is mentioning in the text. In the text what we have talked about, it is all about flexible designs and policies. We are talking about creating policies only, not about designing a healthcare facility, right? So here in the option it says that designing a healthcare. So what is the basic principle of flexible design? This is the question. So we have to be reminded about the question sometimes in between. Okay, so the basic, it says, the option B says that the basic principle of flexible design is to design a healthcare facility which strictly adhere to current policy. No, we are not talking about healthcare facility, we are talking about the policies, healthcare policies. Okay, so just eliminate option B. We don't have to search anymore. This is straight opposite to what mentioning in the text. Okay, option C is changing healthcare policies regularly to match changes in marketplace. We have seen somewhere the word marketplace in the text. Okay, let's read that part again. This may be a result of management change, government policy and turn. Okay, in healthcare, this is in the first sentence itself. In healthcare, operational policies change frequently. The average cycle may be as little as 5 years. This may be the result of management change, government policy and turnover of key staff or changes in the marketplace. So I already explained you, changes in the marketplace can be a reason for changing the healthcare policies within a minimum of 5 years. So option C means changing healthcare policies regularly to match changes in the marketplace. Absolutely right. They did not mention all the other things in the options, but we cannot say that changes in marketplace would not affect the changes in policies. It's already says in the text exactly that the changes in healthcare policies is as a result of the changes in marketplace as well. Okay, you may think that this marketplace, they give subtle importance, because that's why they gave the marketplace option in the last in the sentence. This may be the result of management change, government policy and turnover of key staff or changes in the marketplace. But changes in the marketplace is there, we cannot omit that, right? So when comparing option C and A, option C is the best matching with the question. What is the basic principle of flexible design? Changing healthcare policies regularly to match changes in the marketplace, creating system which match current policy and can adjust to other possible guidelines. There is no adjustment and it is not supposed to adjust with any guidelines. It should be matched with the current policies, and it has the inherent flexibility to adapt to alternatives or forward looking policies, not to be adjusted with the guidelines. The adjust words is not matching with a formal policy or guideline. Okay, it should be something factual, it should be something concrete, not something to be adjusted. Okay, so that's why here in this question option A and B are for elimination, and option C is the right answer here. So let's move on to the fourth question. When prescribing antibiotics for a human bite, what should the medical professional remember? Option A, not all patients should be given antibiotics given the nominal infection risk. Option B, the bacterium Streptococcus species is the most common in bite patients. Option C, Echinella corrodens is not susceptible to several antibiotics often used for skin infections. So let's read the text now. Human bites. Human bites injuries comprises clenched fist injuries sustained when a closed fist strikes the teeth of another person, and occlusive bites resulting from direct closure of teeth on tissue. Clenched fist injuries are more common than occlusive bites, particularly in men, with most human bites occurring on the hands. Okay, human bites result in a greater infection and complication rate than animal bites. Cultural human bites are typically polymicrobial. Mixed aerobic and anaerobic organisms are common, with the most common isolate including Streptococcus species and Echinella corrodens, which occurs in up to one third of isolates. Some authors suggest that all patients with human bites should be commenced on antibiotics prophylaxis given the high risk of infection. The choice of antibiotic therapy should cover Echinella corrodens, which is resistant to first generation cephalosporin such as cephalaxime, fluxacillin, and clindamycin antibiotics that are often used for skin and soft tissue infections. Guys, by reading the question, we can now decide whether we have to read the text completely or just to find out the answer with keywords. When prescribing antibiotics for a human bite, what should the medical professional remember? So this is something related to healthcare. The topic what we usually know. So maybe we can find out the answer with a keyword. So let's check like that. Not all patients should be given antibiotics given the nominal infection risk. The bacterium Streptococcus species is the most common in bite patients. Okay. Echinella corrodens is not susceptible to several antibiotics. So we can possibly find out the answers from the keywords here, because we have seen the word Echinella corrodens somewhere, Streptococcus bacterium somewhere in the text, and not all patients should be given antibiotics. Antibiotics is also a keyword, and in the question also they are asking about antibiotics. When prescribing antibiotics for a human bite, what should the medical professional remember? So let's find out the answer with the keywords. I will explain you anyway all the meaning of all the sentences here, but let's find out the answer with the keywords. Then you can understand how we gonna find out the answers with the keywords. Okay, so not all patients should be given antibiotics when the nominal infection risk. So when the text is talking where the text is talking about antibiotics, some authors suggest that all patients with human bite should be commenced. I'm reading the second paragraph. Okay, some authors suggest that all patients with human bite should be commenced on antibiotic prophylaxis given the high risk of infection. So what does it mean? Some authors suggest that, okay, so all patients, the human bite is most infectious bite. It is already mentioned paragraph A. I will explain you in detail later. But now we are searching to find out the answer with the keyword. That's why I'm not going to explain now. Okay, but should be commenced on antibiotic prophylaxis. So some authors suggest that all patients with the human bites, every patient who got a human bite should be commenced, so should start with the antibiotics prophylaxis given the high risk. Because of high risk of infection, everyone who gets a human bite should be start with the antibiotics without checking any culture or any text or any test. Okay, any blood test, they just start with any of the antibiotic. It is necessary, but the option A is saying that not all patients should be given antibiotics given the nominal infection risk. So it is opposite. It is not straight opposite. It is something opposite. So we can eliminate. But this is not something related to the answer. This is something I have to talk about it. Some authors suggest that the patients with the human bites. So you just have to notice some authors suggest that. So these type of phrases, these type of some authors, some scientist, the writer, so these particular type of things you can see in sometimes in part B and most of the times in part C. So this is a confusing part of the question. So you have to keen to read some authors or some writers. It is suggest or definite or it is factual. So you may have expect so many questions related to this confusing words and phrases. Okay, so OET always try to use this type of particular sentence to make you confused. So here anyway the answer is not option A. We can eliminate option A, but just for your understanding I'm saying that you have to notice the thing. Some authors suggest that all patients with this. So this is this sentence is talking about only some authors suggest that. So it if a point is suggested by some authors, that is not something factual, it is not something real, this is their opinion only. The opinion can be changed with persons, right? So some persons or some other suggestion cannot be considered as something factual and is not applied to a general population. We are talking about all human bites patients, and they are receiving antibiotic therapy, and what all things the doctors has to be kept in mind while they are prescribing antibiotics. So this is our question, and we cannot say that some others such as some people's opinion as the answer for a generalized thing. Okay. So the next option is the bacterium Streptococcus species is the most common in the patients. Okay, let's read any sentences for Streptococcus. Okay, it is here. With most human bites occurring on the hands, human bites result in greater infection application. Okay, culture of human bites typically polymicrobial. Polymicrobial means multiple organisms are there, multiple bacteria are there. Okay, mixed antibiotics and mixed anaerobic and anaerobic organisms are common, with the most common isolates including Streptococcus species and Echinacea corrodens, which occurs in up to 1/3 of isolates. So the option says that the bacterium Streptococcus species is the most common in bite patients. Read carefully. Read carefully. Please don't just superficially just overlook the sentences and come to a conclusion that this is the right answer. If you are doing so, you will be right. You will be wrong. Okay. So mixed aerobic and anaerobic organisms are common, with the most common isolates including Streptococcus species and Echinacea corrodens, which occurs in up to 1/3 of isolates. It is not saying that only Streptococcus species is the most common bacterium. It's including Streptococcus species and Echinacea. And means that is equally important. If we use the connective and to connect two things or two sentences or two words, which that means the sentence comes before and the sentence after and is absolutely equally important. Okay, for example, if we use as well as, we may come to a conclusion that the first thing say before as well as before the connective as well as is a bit more important than the last thing. For example, a patient should be considered to take paracetamol as well as metformin after discharge. So it's mean that the paracetamol has a little more important than metformin. That doesn't mean that the patient should not take metformin, but the first part of the sentence which comes before as well as has an implied meaning of much more important than the second. But in case of the connective and is purely used to connect two things which are equally important. So we cannot say that bacterium Streptococcus species is the most common in bite patients. Both Streptococcus and Echinacea corrodens are equally most commonly seen in human bite infected patients. So option B is absolutely wrong. Okay, it is right that bacterium Streptococcus species is most common, but it is not only bacterium. There is Echinacea corrodens as well. The option says bacterium Streptococcus species is the most common. So that is given prime importance to only bacterium Streptococcus is the most common. So it strictly says that it is the most common. No, it is not the most common. There are two bacterium. So we can eliminate option B. So next go to option C. Echinacea corrodens is not susceptible to several antibiotics often used for skin infection. We have seen somewhere, right, the skin infections. Okay, let's read the last paragraph, which is most totally talking about antibiotics. Okay, some others suggest that we already read that sentence, given the high risk of infection, the choice of antibiotics. So this is the exact sentence what we have to look for the answer, because our question is for when prescribing antibiotics for a human bite, what should the medical professional remember? So the choice of antibiotic therapy should cover E. corrodens, which is resistant to first generation cephalosporins such as cephalaxin, fluoxacillin and clindamycin. Clindamycin, there is a comma after that. Then the things which explained after the comma is something has to be used to describe the word before the comma. So clindamycin comma, the other part of the sentence after the comma is something is to describe clindamycin. Okay, and clindamycin antibiotic that are often used for skin and soft tissue infection. So what does the sentence totally mean? The choice of antibiotic. So when prescribing or choosing an antibiotic for a human bite, the doctors should consider that the most common, one of the most common species, E. corrodens, is resistant to all the first generation antibiotics, first generation cephalosporin, fluxacillin and clindamycin antibiotics that are often used in skin and soft tissue infection. So let's read the option again. Echinella corrodens is not susceptible to several antibiotics often used for skin infection. So here there is a word susceptible. So guys, you have to understand some of the vocabs which usually comes in option part B and part C, because as I told you before in the first question, they would not use the same sentence in the text and the options, so they will rephrase it. They use different types of vocabularies to rephrase the same sentence into the options and the text. So here you have to understand some of the vocabularies, then only you can understand that this phrase is talking exactly about what they have given in the option. So here Echinodea corrodens is not susceptible to several antibiotics means it is resistant to antibiotics, resistant to several antibiotics. In the text they have given it is resistant to first generation antibiotics and clindamycin antibiotic that is used for skin infection. Susceptible is the same meaning word. Okay, so just make sure that you have a bunch of vocabs, not bunch of vocabs, you should have some of you should have a clear idea about vocabularies that usually comes with the healthcare related topics. Okay, so here the option A and B is for elimination and option C is the right answer. So let's move on to the first question. According to the extract, to prevent the spread of infection, emergency department isolation rooms. First option should be placed away from the main entry door. Option B are more numerous than those of other department, and option C ought to be situated near where people enter the unit. Guys, this is simply we can find out this answer because from the question itself we can understand that this is the answer can be easily found out by searching the keywords. According to the extract, to prevent the spread of infection, because of spread of infection, emergency department, this is something related to our profession and we knew already about this thing. Okay, so we don't have to read anymore. Just check the options again for keywords. Should be placed away from the main entry doors, are more numerous than those of other department, ought to be situated near where people enter the unit. So away from main entry door. Let's check the aim of, let's read just superficially. The aim of environmental control in isolation room is to control the airflow, controlling the quality and quantity intake, maintaining different the location and design of isolation rooms within a particular department. The location and design of isolation room within a particular department or inpatient unit should already enable their separation. So there is nothing talking about emergency. Multiple isolation rooms should be clustered and located away from the main entrance of the unit. Okay, multiple isolation rooms in the we have seen somewhere are more numerous than those of other department. We are talking about isolation rooms in the emergency department, right? So where it say about emergency department, an exception is an emergency department. So here only they say about emergency department. All other sentences before were talking about only the isolation room, but our question is for to find out the isolation rooms in the emergency department. So here we found out the emergency department. An exception is an emergency department where it is recommended that designated isolation rooms be located near the entry to prevent spread of possible infection, airborne infection throughout the unit. So when it comes to the isolation room of emergency department, it should be located near to the entry to the emergency room. Why it is being kept like that? Because if the isolation room kept somewhere there in the unit, there will be chance of spreading the infection throughout the emergency department. So it's always better to keep at the entry, at the opening side, or the open door or the entry door of the isolation room. Okay, so let's go back to the options again. Should be placed away from the main entry, no, entry door. Is that right? No, right? Because we just read that it should be close to the entry door. So option A is straight opposite. Just delete it, not delete, just keep it for elimination. And option C are more numerous than those of other departments. No, we haven't seen that there are numerous isolation rooms in emergency room. We are just talking about it is just talking about the location, right? They just talk about the emergency room in the last sentence only, and just they talk about the location of the isolation room. They did not tell something about the number or how many isolation rooms are there should be in the emergency room. So one are more numerous than those of other department. No, nothing is there. The isolation rooms is everywhere, but an exception is emergency department, where it is recommended that it is talking about the location. So option C is ought to be situated near where people enter the unit. So near where people enter the unit, what is it mean? Where people enter the unit? The entry door, right? Through the entry door only the people could enter the unit. So that means ought to be situated near where the people enter the unit. So that sentence is clearly rephrased here in the text as it is recommended that designated isolation room can be located near the entry to prevent the possible infection. So the same sentence has been rephrased here. So the answer here is option C. Option A and B is for elimination. So guys, the last question is, what is the basic difference between delegation, referral and handover? This is comparatively very easy, guys. That's why I just put this one at last. And we already know about what is delegation, referral and handover. This is most usually heard in healthcare settings and in between us, right? Because we are the one usually getting referrals, we handle handovers, and we also delegate the duties to nursing aides and nursing students. So we know these things. So no need to concentrate more, just find out from the keywords. So option A, how many practitioners are involved in each part of the process? What is the basic differences between? Okay, we are searching for the difference between these three terms. Okay, the option B is how much authority is attributed to each practitioner, and option C is how long each of the processes take a practitioner to complete. So we just have to look the differences between these three terms. Delegation, referral and handover. Delegation involves one practitioner asking another person or member or staff to provide care on behalf of the delegating practitioner, while the practitioner retain overall responsibility for the care of the patient. So that is what is delegation. Delegation means we are delegating, we are disseminating the duties to someone else, for example a nursing aide or nursing student, but at the same time we keep the authority with us. We are the one should responsible for their actions, right? We have to keep the responsibility while we are delegating. We cannot leave the authority completely to the person to whom we are delegating. We have to keep the responsibility still with us while delegating some duties to them. Okay, then the next is referral. Involves one practitioner sending a patient or client to obtain an opinion or treatment from another practitioner. Referral usually involves the transfer in part of responsibilities for the care of patient or client, usually for a defined time and a particular purpose, such as care that is outside the referring practitioner's expertise or scope of practice. Okay, so that is what is referral. Referral means a practitioner or a consultant or a doctor is referring a patient to a particular consultant or a specific doctor to get an information or treatment for his patient, the service which is out of his scope of practice. So he cannot deliver this particular aspect of care. That's why he refer his patient to someone else who can provide quality of service related to that specific complaint. For example, I am getting a treatment from a neurology doctor for some problem with my spine. But at the same time, I have a dermatic issue, I mean dermatological problem. But this neurology doctor cannot treat me with my dermatological issues. So he refer me to a dermatologist. But I am his patient. I am this neurologist patient, but he is referring me to someone else to treat a specific problem. Okay. So that is referral. Okay. Then the next is handover, is the process of transferring all responsibility to another practitioner. So handover means a doctor or a nurse or someone who is treating a particular patient is transferring that patient to another practitioner with all the responsibilities. Okay, they give handover. That means they give all the responsibility to the other person who take over the handover. Okay, so that is what is called handover. So let's go back to the question again. What is the basic differences between delegation, referral and handover? How many practitioners are involved in each part of the process is a big blunder. Okay, how many practitioners, that doesn't matter in these terms, right? Everyone can give handover. Everyone in the healthcare settings can give the handover. And how many persons included? Most probably two, right? One person, one nurse is giving handover to another. But in some cases there are a group handover can be taken place in hospital settings. For example, morning rounds or and head nurse is handovering key information to her group of subordinates. So these all are also handover. So we cannot say that one person or two person or how many. It is not differentiated based on how many patients. This is not how many people involved in the handover. This is not what exactly the differences between these three terms. The next option is how much authority is attributed to each practitioners. How much authority? Option C, how long each of the processes takes a practitioner to complete. We did not see anything related to how long each practitioner take to refer, or we did not talk about duration of these things, right? So there is nothing in the text mention about duration. So it's for elimination. So we eliminate option A and option C. Then just look at option B. How much authority is attributed to each practitioners? This would be the right answer, because I explained everything, delegation, referral and handover. When I explained you the three terms, I mentioned that in delegation we keep the responsibility with us, we only delegate some duties. But for referral also, the doctor referred to another consultant for specific treatment, but the patient still under the first consultant. But for handover, the authority is completely handovering to the next consultant. So here what we can say, the authority matters. So that's why option B is the right answer here. Okay. So guys, we completed 5 questions. So I'm leaving the 5th question for you to solve. I will give you the answer options in the description box or in the comment section. So just try to find out the answer. If you have any doubt, just reach back to me. I will explain again and I will clarify if you have any doubt. Or you can send me a message in Telegram. I will respond. Okay. So guys, that's about today's video. Hope this video will be helpful to you in your future practices. So till we meet in the next video, bye for today. Thank you.